Office of the Public Protector has released a number of investigation reports on the state of public healthcare facilities in Limpopo, Mpumalanga, KwaZulu-Natal and Gauteng. Advocate Busisiwe Mkhwebane visited dozens of public hospitals in 5 provinces to assess how the facilities coped with the demand for services. She also looked at whether sufficient safety measures were being implemented to protect workers and the public from contracting COVID-19. Mkhwebane says the investigations revealed systemic issues in most public hospitals in KwaZulu-Natal, Mpumalanga, Gauteng and Limpopo. These include delays in the distribution of PPE, staff shortages, poor physical infrastructure, lack of laundry services, human resources, vital equipment and poor IT connectivity. The Public Protector says government needs to act and give these facilities the support needed to improve services. The Public Protector joins us now to talk more on this disturbing series of reports. Advocate Mkhwebane, good evening to you, and thank you so much for your time this evening. It's very disturbing that we're seeing such a picture emanating in a month that we call Good Governance Month.
Yes, Bongiwe, good evening to your listeners and your viewers. Indeed, it's very disturbing, and you know, it's good that we can avail such reports for those in the executive and those in the public service to utilize them and see the state of our health system, especially as well that we are still faced with the challenges of COVID-19. It's even worse that a lot of the hospitals, you'll see that besides the COVID-19 or COVID readiness or before the disaster, they have been in that horrendous situation, and some of them are still continuing, even though we visited these hospitals last year, September, most of them. And we issued a quick wins report where we were identifying areas which they need to improve on immediately. And then we continued with the investigations since we are issuing the report this month.
It sounds then like if you were there last year and fast forward to this year as well, and there's still these particular problems, there might be then a lack of will, you know, on the part of those in charge to be able to also do things right here. Is this a case of incompetence of those in charge, or could there be more here?
I think it's a mixture of several several issues, Bongiwe, because if you are the CEO of an institution and you don't have the resources, for instance, the PPEs, your hospital's infrastructure is dilapidated, you've raised the issues, you can't procure on our own, because that's the biggest challenge as well we've picked up in all the hospitals, especially where you'd find that the CEO is at the level of a deputy director in a public service. That CEO is only allocated or can only delegated to only procure anything which is below 500,000. That CEO depends on the provincial government to procure for them anything or any goods which are above 500,000, and that is processed centrally, and that is done by very lower level staff members. And you'd find that they don't have then the resources, but they'll have to wait for the provincial office to provide. On others, yes, it's an issue of incompetence, because I mean, you'd find that there is staff, you have staff complement, enough staff complement, but the services which are provided to the community are not up to scratch. For instance, Lile Ngoi, where there was a lot of complaints, people saying we wait for long hours and we are not assisted, and institutions like Steve Biko, though we didn't manage to get into the wards, because by then they were using makeshift tents outside, which they are still doing, and then all COVID related cases being referred to the Pretoria Central Hospital. But even today, there are still complaints about Steve Biko because of how patients are being treated, especially in the casualty ward, where you find that it's just a very chaotic environment, and that is purely a management supervisory issue, which will have to make sure that they streamlined processes. So that's what people are faced with, Bongiwe. And I indicated earlier that the one in Muleji, this Nobel Hospital, even locals are saying, if you go there, you will never come back. Indeed, because people are not attended to, the patients, and there are no services. I mean, it was horrible when we were there. The COVID-19 ward, there are 2 sisters there, and they were saying we are using this just one room. There's no ablution facilities, and a person who's HIV, who's having a COVID-19 virus will have to pass through another ward to go to use the ablution facilities, unless then they'll have to use other means. So in Mpumalanga, it was even worse, Chamber Hospital, because it's only 2 rooms. Actually, it's 1 room where there's a delivery room. Now, if they deliver 13 to 18 babies a day, and there's no privacy, the beds, in fact, it's 2 beds there which are dilapidated, they are not clean, filthy. So again, we are saying, then you'd find nurses or health workers who are very not nice or rude. Sometimes others, it's because of their work environment, because thinking of going to that environment and where you'd have to work under those difficult environment, then people don't have then the Batupili services where they will treat customers or patients with courtesy. So those are the things which we have seen in Lilian Goi. No, the geyser is not working, no hot water. I mean, then you have a CEO, you have management. You'll wonder as well, why are you not following up? Yes, you've raised the matter with the province, but where's proof? In Mpumalanga, they were saying, Public Works was saying, no, we never received anything in writing. Now it's then that when we intervene, they wrote to the Department of Public Works and say, this service provider is not delivering the service. So it's a mixture of a number of things, but at the end of the day, that's what people are subjected to. And hence we are saying as an office, this is a tool for you as HODs, MECs, Minister of Health, President, the tool which you can use to go back and provide the services in these hospitals. And at least it will, in a way, change the lives of the patients or even anyone who needs the services.
This is very disturbing, especially when one reads this report in greater detail. When you look at a place like Lilian Goi, there isn't even nutritional food for those that are staying overnight. And you look at George Mukari, for example, there's, even a lot of other issues that continue there. You look at Steve Biko, there's talk of routine checks that are done by departments that are in charge, but roofs still continue to leak. A lot of, worry continues to then build up when you read such a report. What becomes the role of the provincial government to ensuring that this situation that residents are experiencing and patients are experiencing really comes to an end?
I said the recommendations which we have made, and I must indicate as well that during our investigations, then they were cooperating a number of officials, especially in the hospitals, the CEOs, the management, but then even the provincial department. And they then started having some interventions in various hospitals where they had to make changes. For instance, making sure that the linen is kept clean, linen goi. They then changed, they provided the nutritious warm food. They also had to fix the geyser so that there's at least warm water and it's warm. But then what we have done then is that we have recommended various or brought about various remedial actions which, if implemented correctly, at least it will assist various provincial departments to in a way provide a habitable or environment for the patients and for the staff and management in various hospitals. I just want to take you through the general recommendations which we have made to the CEO, especially in Gauteng, and which we said it will be applicable to all the hospitals across the province. Because firstly, the supply chain management units which needs to be reassessed, the issue of centralizing everything to the province. I think they need to relook the levels of or the delegations which have been allocated to the CEOs to be able to procure things quicker and also be supported with experienced supply chain practitioners. That will also cause the delays to be eradicated in the process. Implement quality assurance measures or mechanisms to guard against the provision of substandard items. I mean, the province procuring PPEs which are substandard, which are given to the various hospitals, and when they are utilizing them, the masks are even tearing or they cannot be reused. But then on other hospitals, there are masks which can be reused, and there are equipments which are there to do that. So at Lilian Ngoyi as well, we've indicated that at least they've improved, but then the issue of risk management, the issue of meeting the staff, having the risk plan, even at STIP, because that was non-existent. Issue of waste management, because you'd find that waste is piling and piling, it's filthy, it's not, so that also needs to be taken into consideration.
Now,
other hospitals, at least they've managed to as well employ more professional nurses, because like in Mpumalanga, they had vacancies, at least they filled some posts.
Now, Advocate Mkhwebane, we're almost out of time, but I can't let you go without asking you this particular question. I mean, when you think about what is happening right now, looking at this report and the picture that it has painted, and you look at the scandal that the National Department of Health is finding itself under, the Digital Vibes scandal, this could have been money that could have been utilized even for such services for these hospitals to get some kind of assistance.
Definitely. Earlier I was asked whether we received any complaint about Digital Vibes, Bongi, where I was not aware, because normally complaints are lodged through our registration email and they are allocated to investigators. The only time I become aware of any investigations or complaints is when it's brought to my attention through a Section 79 notice or a report. But then the complaint was lodged by a member of the public, though it was not a EMEA-related complaint. Hence, that matter was just lodged in May. And I indicated that at least the SIU's investigation has uncovered a lot, and there's a lot of actions which have been taken against the various officials. But I think as well it's very much concerning to hear that even the minister was involved or is implicated in certain transactions, whereas the minister is not supposed to be involving themselves in any procurement. Indeed, that money would have assisted other, in fact, in the health in health provision or the necessary equipments which are needed in various hospitals. Because, for instance, in Jubilee, we were told, okay, they are building this alternative build technology, but then our biggest need is that we need x-rays, we need ICU equipments, basic things which can be utilized to at least provide proper service or health service to those in need. It's a concern indeed, definitely. I hope that will be followed up to the T. We will check from our side what more can we do, because remember our reports, remedial actions are binding, and as well we handle or we deal with systemic challenges which we are revealing to various state institutions that this shouldn't be repeated going forward. So I'm pleading with the health sector, whoever is in this space, to use these reports, and indeed it will at least bring a lot of changes to the recipients of the services. And
as we wrap up then our conversation very briefly, Advocate Mkhwebane, we saw in other news your COO, Charles Mohalaba, being quoted in the media saying that his time there in your office is a period he would like to quickly forget. What happened here? Did you guys have a fallout for him to get to this point?
No, I requested the CEO earlier to answer that question, because he submitted his resignation letter to the CEO, and apparently it was just 2 sentences that he's decided to resign with immediate effect, and apparently he was called to ask for further information, and he indicated that he discussed with his family. So I think it's for personal reasons, and I must say, Bongiwe, that we are swamped as an institution. We don't have resources, especially human resource constraints. Possibly he couldn't keep up with the workload, but I must indicate that we thank his contribution, and we will go forward and, with the team which is there to deliver the services to the South Africans, because that's the biggest focus which we are concerned about.
Advocate Mkhwebane, thank you so much for your time this evening. We certainly do appreciate it. That was Public Protector Advocate Busisiwe Mkhwebane. A very disturbing report coming out, of that office, painting a dire picture of the state of some of the healthcare systems across the country. We do hope that officials are really looking at this, especially because people really need to use these facilities during, in fact, every day of their lives.